When we think about health, our minds usually go to things like diet, exercise, or trips to the doctor. But what if I told you the biggest factors shaping our health are actually decisions made in rooms we're not even in? That's what we're going to get into, the policies that can create and solve health inequality.
So let's start with that huge question. Why isn't health the same for everyone? It's so easy to just point to things like whether someone can see a doctor or the personal choices they make. But the data, well, it tells a much deeper story. A story that starts way, way before anyone ever steps foot in a clinic.
The best way to wrap your head around this is with a metaphor about a river. Now, a downstream approach is like standing in the river, pulling people out one by one as they float by. That's treating sickness after it happens. But an upstream approach, that means walking up the riverbank to figure out why people are falling in and stopping it from happening in the first place. And that is all about policy change.
So what do we call these upstream factors? Well, there's a name for them: social determinants of health. This is the real stuff of our daily lives: where we live, the schools we go to, the jobs we have, the safety of our neighborhoods. These aren't just details. They are literally the building blocks that determine whether or not we even have a fair shot at a healthy life. So, how in the world do you connect a big policy decision with an individual's health? It seems like a huge leap, right? Well, you need a map. In this first part, we're going to look at a framework that helps us trace the path from these big societal structures all the way down to why health outcomes are so unequal.
And that map comes from the World Health Organization. Their Commission on Social Determinants of Health, or CSDH, created this amazing framework. Think of it like a diagnostic tool. It helps us follow the breadcrumbs from these really high-level policies all the way down to the real-world conditions that either help us thrive or cause us harm.
And here's where this gets really powerful. It completely flips the script on how we talk about problems. Take a tough issue like child neglect. Instead of blaming individuals, bad parents, this framework forces us to look at the bigger picture, to see the stressful, unhealthy, and often impossible conditions that make good parenting so much harder.
And look, this isn't just some abstract theory. The numbers are, well, they're staggering. Get this. Children in low-income families are at a nearly 5 times greater risk of abuse or neglect. That gap is not an accident. It's a direct symptom of those upstream policies we've been talking about. So let's actually trace that chain. On the far left, you see it all starts with structural policies. Big things like how schools get their funding or who gets approved for a housing loan. These policies then directly impact a family's socioeconomic position, their education level, their income, and that in turn creates the intermediary conditions they live in every day, like poverty or neighborhood violence. And what's at the very end of that chain? The health outcome, that tragic increased risk of child abuse.
Okay, so if that's the map of the problem, what's the playbook for the solution? In this next section, let's explore a couple of really powerful tools that policymakers are using to get upstream and build healthier, more equitable communities for everybody.
First step in the playbook is this really big idea called health in all policies. The concept is actually pretty simple, but it's revolutionary. It says that every single policy decision, whether it's about transportation, education, or housing, is also a health policy. It's about committing to thinking about the health effects of every decision a government makes.
And what this really means is we have to break out of our silos. Health isn't just made in hospitals, right? It's made in our communities. It's made by transit systems that get people to good jobs, by housing policies that give families safe homes, and even by justice systems that promote community safety. Health in all policies is all about building those bridges between different sectors.
So how do you actually do this? Well, a key tool is an impact assessment, but there's a really important distinction here. A standard health impact assessment, or HIA, asks a pretty straightforward question: what are the health effects of this policy? But a health equity impact assessment, a HEIA, that one goes a huge step further. It asks the tough questions. Who is helped by this? Who might be harmed? And is the final outcome fair? It puts social justice right at the center of the conversation.
This all sounds great, right? But is anyone actually doing it? You bet. In our final section, let's look at how this playbook is being used in the real world, at the federal, state, and even local levels all across the U.S.
At the very top, at the federal level, we've definitely seen this shift in thinking. The Affordable Care Act had parts specifically aimed at reducing disparities. The National Prevention Strategy pulled in departments from transportation to education. And for the first time ever, our national health goals, Healthy People 2020, specifically included a focus on the social determinants of health.
And it's not just happening in D.C. States are really stepping up. Take California, for instance. They created a super impressive Health in All Policies task force, with the goal of making sure that every single state-level decision also moved the needle on health and equity for everyone in California.
And this wasn't just talk. They got real things done. They created a farm-to-fork office to connect local farms with communities. They developed guidance so new schools and houses wouldn't be built right next to sources of pollution. They even used environmental design to make neighborhoods safer. These are real, tangible, upstream wins.
The work gets even more specific when you get down to the local level. In King County, Washington, that's where Seattle is, leaders saw these huge inequities in everything from school enrollment to how long people lived. They decided to make equity a core mission of the entire county government.
And how'd they do it? They identified 14 determinants of equity. And just look at the things on this list. We're not just talking about healthcare. We're talking about affordable housing, jobs that pay a living wage, community safety, and a fair justice system. They basically declared that all of these are essential health issues, and now every part of their county government is responsible for making progress.
So if there's one thing to take away from all this, it's this. Improving access to doctors and hospitals is absolutely important, but it will never be enough to achieve health equity. It just won't. True health equity demands that we look upstream at the policies and systems that shape our lives from the very beginning.
You know, this quote from the source material just nails it. Reducing health inequities isn't going to happen by accident. It takes a deliberate, intentional focus on equity, not just from our public health agencies, but from all the other sectors that have such a huge impact on our well-being.
Which leads us with a final question. For you, the next time you walk or drive through your community, try looking around with this new upstream lens. What decisions about the parks, the roads, the housing, or the schools are shaping the health of your neighbors? Because that right there, that's where the real work of building a healthier, more equitable society truly begins.